If you suffer from osteoarthritis of the knee, your doctor might prescribe a knee brace. Osteoarthritis is when the cartilage cushioning the knee joint wears out, causing bone to painfully rub on bone. A brace relieves some of that pain by realigning the leg to shift weight off the knee joint. This dual-action knee brace rotates the foot, which moves the thigh bone, the femur, off the most painful area of the shin bone, the tibia. It also creates what's called a distraction, pulling the femur and tibia slightly apart to further reduce stress on the joint. The brace is custom-made for each patient. An orthotist takes the measurements by passing a sophisticated 3D scanner approximately 12 inches above and below the knee. The scanner translates the data into a 3D computer image with highly specialized medical device software, then processes that image into anatomical blueprints for a 3D model. The computer then reads the plans and guides this carving machine to create the model from a block of high-density foam. The carving process takes about 10 minutes. The finished model is an exact replica of the patient's leg, which technicians now use to construct a brace that fits the patient perfectly. After wrapping the model in plastic film to protect the surface and marking the main anatomical landmarks of the knee, they lay a thick foam band over the tibia and begin marking where they'll install the two articulation hinges, which rotate the foot and distract the femur and tibia. This template is for the lateral hinge, the primary rotator. It's situated on the outside of the leg. Next, taking an aluminum bar and bending it on special tools, the technicians form the brace's tibial crossbar, the band that crosses the shin and holds the two hinges. The foam band takes up the space of a silicone lining that'll go under the tibial crossbar, critical cushioning to prevent pressure points that can cause skin irritation. Once the crossbar fits perfectly, they reapply the template and mark where rivets will attach the lateral hinge. Then, using the same metal bending tools they use to shape the crossbar, they contour the hinge to follow the shape of the leg. They attach the lateral hinge to the tibial crossbar with copper rivets. Copper is a soft metal, so they can compact it to produce a solid joint, which won't loosen up over time with repeated use. At the other end of the crossbar, they affix the medial hinge, which produces the distraction. When the knee is extended, this hinge lengthens the brace by approximately 3/4 of an inch, pulling the tibia and femur slightly apart to eliminate pain. It's time to mold the plastic shell, the upper part of the brace that fits onto the thigh. First, they soften a foam sheet in a low-temperature oven and wrap it around the model. This takes up the space of the fabric lining that'll go under the plastic. After covering the foam in a cotton heat barrier, they soften a plastic sheet in the oven, wrap it around the model, staple the ends together, then coat the surface in talc, which prevents their gloves from sticking when they apply pressure. Once the plastic cools, they trace the shell shape and cut it out. Then they wrap it in a protective vinyl finish, heating the material so that it becomes sticky and adheres to the plastic. They also wrap the tibial crossbar in vinyl. Then they apply a strip of Velcro to the underside where they'll later adhere padding. They install a cover over each hinge to protect the mechanism. Then they cut a fabric lining for the upper part of the brace. It adheres to the plastic with Velcro so that it's removable for washing or for replacement when worn out. The brace applies the greatest amount of pressure at the tibial crossbar, so they line the crossbar with silicone padding for comfort. The pad attaches to the Velcro strip. The brace fastens to the leg with 3 adjustable straps and works only when the knee is extended, which is when osteoarthritic pain hits the most.